So the IBIS-2 DCIS trial was really a study looking at anastrozole versus tamoxifen in women who had hormone receptor positive ductal carcinoma in situ. Previous evidence has shown that tamoxifen is really effectively reducing recurrences in women with DCIS. And this is one of two studies that has compared anastrozole, an aromatase inhibitor, to tamoxifen to see whether anastrozole is better in reducing breast cancer recurrences. So this study included just shy of 3,000 women who had hormone receptor positive DCIS. They were all postmenopausal, and recruitment was from the early 2000s till 2012. And women were either randomized to receive anastrozole or tamoxifen, and the active follow-up period, so the treatment period, was for 5 years, and then we still follow them up until this day. So what we found essentially is that overall there was no significant difference in breast cancer recurrences, in the reduction of breast cancer recurrences with anastrozole when compared to tamoxifen. So we observed overall a relative 11% reduction with anastrozole, but this was statistically not significant after 12 years of median follow-up. I think what is most important in our findings is that we did find differences in adverse events, which is very important for women on these hormonal treatments. So with tamoxifen, we observed an excess in particularly in endometrial cancers and ovarian cancers compared to anastrozole. And with anastrozole, we found that women develop more fractures compared to tamoxifen. And also maybe a kind of surprising finding was that we observed a threefold increase in strokes in those women who received anastrozole compared to tamoxifen. Overall, other cancers were very similarly, so did not observe any different effect of these treatments in terms of all-cause mortality. And specifically in terms of breast cancer mortality, we only observed a total of 6 breast cancer deaths until so far. So there really is no differences in these two treatments with regards to breast cancer mortality. So I think overall we did not observe a significant or a more efficient effect of anastrozole compared to tamoxifen in women with hormone receptor positive DCIS. Particularly important is that we did observe a different adverse event profile, and I think in the decision-making process then for the patients with DCIS, it's really important that they take that into account.